Staying in state news, North Carolina is one step closer to expanding Medicaid as our state's General Assembly reaches an agreement today. Now, under the agreement, lawmakers will partially repeal some of the state's laws that limit competition in the healthcare industry. Hospitals will be able to access billions of dollars in federal funding. That is according to officials. Now, the state will also get a bonus of about $1.8 billion from the federal government. Now, to your sides, Caitlin Richards spoke with local representatives. And Caitlin, how could this agreement impact us right here in Eastern North Carolina?
Courtney, ECU Health says Medicaid expansion will provide coverage to more than 100,000 people here in Eastern North Carolina.
And at the end of the day, what we know is we're going to have a legislation, we're going to have a policy that is going to expand access to working North Carolinians, that is going to ensure that there is a more robust supply of a lot of these services.
The federal government covers 90% of the costs of Medicaid recipients under expansion. Potentially 600,000 people in North Carolina that currently don't qualify could receive the benefit. Thursday's agreement comes as a breakthrough after years of debate within state politicians in the General Assembly. But now some lawmakers from both parties are hopeful this agreement will get passed.
When you're talking about taking 30 minutes or 45 minutes to get to the hospital, time can kill you. So I think that, with this being passed, once we get it, it's going to help a lot of people. It's going to save some lives.
This is going to be an economic driver for the hospitals, the physicians in Eastern Carolina that has a disproportionate share of the uninsured population. So it's going to provide health care. It's going to provide a financial lifeline to our hospital and our physicians. It's going to be an economic driver for North Carolina.
Representative Reeder adds the Rural Health Center estimates Medicaid expansion creating over 80,000 jobs in our state. North Carolina is one of 11 states that currently does not have Medicaid expansion. Governor Cooper reacting to what he calls a monumental step, posting on Twitter in part, quote, "We should make it effective now to make sure we leverage the money that will save our rural hospitals and invest in mental health. I look forward to reviewing the details of the bill." Both Representative Reeder and Representative Willingham are hopeful that the agreement will continue to move forward in the coming weeks, but is expected to not go into effect until early summer. In studio, Caitlin Richards, 9 on your side.